An ABC 15 investigation on a form of permanent birth control is getting a lot of attention tonight, national attention.
Women continue to speak out about Essure, and as Lauren Gilger explains, a month after our report, the feds have ordered a complete review.
You're on an emotional roller coaster.
Jennifer Gabaldon is a mother of two. With a full house, she wanted a permanent form of birth control. She chose Essure, a procedure in which metal coils are placed inside the fallopian tubes to block conception.
It's scary, yeah. It's not safe.
But for Jennifer, what was promised is not what happened.
Essure just basically didn't do its job. And because of that, we had to pay the price. Other women have to pay the price.
Felt like I had barbed wire inside of me.
Jennifer is one of more than a dozen women in the Valley who contacted the ABC 15 investigators about debilitating health problems they say were caused by Essure.
How many of you ended up in the hospital?
These women are part of a larger group sharing their experiences on Facebook. Many describe the exact same symptoms: extreme bloating, skin rashes, and headaches. X-rays show coils cutting through fallopian tubes, and women post photos of broken coils after they were removed. Now, there are more than 3,500 women in the group, and the numbers keep growing. Patients and doctors also reported these same problems to the Food and Drug Administration. The federal government received a total of 943 adverse event reports about Essure, including the first reported death associated with the device. Now, a month after our initial investigation, the FDA responded to public pressure. In a statement posted on their website, the agency says they reviewed the complaints and the clinical trial documents. The FDA states at this point it's found no evidence of more widespread complications about Essure.
It shouldn't have happened. I did everything right.
4 weeks after doctors confirmed Jennifer's Essure coils were in place and working properly, she says she woke up in unimaginable pain.
I fainted. My husband heard me fall and hit my head on the shower door.
After fainting 2 more times, Jennifer's husband rushed her to the emergency room. Doctors found she had an ectopic pregnancy that burst in her fallopian tube. She underwent emergency surgery that day.
Nobody's given me any explanation. Everybody's just kind of dumbfounded, like, why did this happen?
Jennifer had both fallopian tubes removed. Her body is healed, but she is still dealing with emotional scars.
It's sad because even though we weren't trying to get pregnant, I had lost a pregnancy.
It's a very safe, effective sterilization procedure.
Dr. Joel Falk is an obstetrician in Gilbert. After our initial investigation, he contacted us when 2 Essure patients canceled.
I just have a hard time believing that this procedure that is an innocuous little coil that's very soft and very pliable is causing all these problems.
Dr. Falk says he's implanted hundreds of Essure coils and only had a few problems.
I certainly would have heard about it with my patients.
Essure has been on the market since 2002. According to the manufacturer, about 750,000 women have had it implanted.
For me, it was worth it.
Bobby Jo Carter of Gilbert is one of Dr. Falk's patients who has Essure.
It took maybe 10 or 15 minutes, and that was it. Woke up, went home, was cramping for maybe that day, and the very next day I went back to work. I was fine.
At the same time, Dr. Falk defends Essure. He recognizes many medical issues are underreported to the FDA.
If the system were different and we could report complications without the fear of being sued, then I think doctors would be more comfortable with reporting complications.
For Jennifer, the danger lies in the complications themselves.
I almost died, and my children almost lost their mom.
We reached out to the current manufacturer of Essure, Bayer Healthcare, about this story. They sent us this video response.
We are saddened to hear of any patient who has been harmed by any one of our products, regardless of the cause.
Bayer cited the FDA's findings in their response, as well as a recent practice bulletin by the American College of Obstetricians and Gynecologists. It recognized the procedure has high efficacy and low risk and cost. You can see Bayer's full statement on our website at abc15.com/investigators. I'm investigator Lauren Gilger, ABC 15 News.